Hey everyone, welcome or welcome back to my channel. I hope you guys are having a better week than me. So, a black woman is dead. This woman here, Adriana Smith, they're keeping her body alive because she's pregnant, and no one in her family has any say. This is what it looks like when black women are treated as less than human in the medical system. Adriana Smith went to the hospital because she wasn't feeling well. She was 9 weeks pregnant. They sent her home. They didn't help her. And now she's gone. But the hospital is keeping her body alive against her family's wishes because of the pregnancy. Because of the Texas heartbeat law, if they let her body die, it's technically an abortion. So the doctors are forcing her body to stay alive. Her mother and partner have no say in what happens to her, but they're expected to pay for it. They're expected to pay for the hospital bill. And here's what they're not telling us: the massive amount of drugs being used to keep her body alive, it's almost certain that the baby will be born with serious birth defects, if it even survives at all. Black women are still seen as having a higher pain tolerance, still being dismissed when we go to the hospital. She shouldn't even be dead right now if they took her pain seriously, if they took her seriously when she went to the hospital. But guess what? They will definitely use our bodies as incubators. They will definitely use us when necessary, just like they did back then. This isn't just about one woman, this is an experiment to see how far they can push us, to see if they can use our bodies as incubators again, like they used to back in the day, to see if the public will stay silent. And, yes, we make these videos. Yes, we go public. We talk about it, but then we close our phones, including me. I stop the video, I post it, and then what? I move on to the next story. Even if I wanted to protest, even if I wanted to, get up and be enraged and scream, how? Where? When? We're not coming together to protest. We're not coming together to really make a change. They're testing to see how far they can push us. How many of us will sit behind our screens, talk about the issue, and then close our goddamn phones and move on? I would love to protest. If there's anything going on, let me know down in the comments. I want to know, because fuck this shit. Let the birth rate plummet. I am so happy with women who are choosing to be single, who are choosing to be child free, because fuck the birth rate. We know it was never about being pro life, it was always about being pro birth. We know damn well they do not care about these children once they are born. Once these kids are here on this planet here, once they take their first breath, they stop giving a fuck. I know we talk about this, we talk about it, but like, what are we doing? I am so sick of this. Like, what are we doing? What actions can we take? I feel so powerless right now, and I know her family feels the same way as well. I'm going to share some stitches with you guys, some people's opinions, even doctors' opinion on this issue as well. But please, let's continue this conversation down in the comments.
New questions about Georgia's controversial heartbeat law. Adriana Smith's family says they've been forced to wait without a voice while doctors try to keep her body functioning long enough to deliver her baby.
11 Alive's Cody Alcorn is live outside of Emory Midtown, where Adriana was just moved hours ago. Cody, what have you learned about what's going on here?
Well, Jennifer and Ron, Adriana has been on a ventilator for the past 90 days. Now, as you mentioned, she was moved here just hours ago so doctors can deliver her baby when it is time. Her family visits her every day, including her young son, who believes his mom is just sleeping. A crushing emotional toll, as you can imagine. The family says it's been made worse because they have no say on what happens next. 30-year-old Adriana Smith was about 9 weeks pregnant when she started having bad headaches in February.
Enough to know that something was wrong.
April Newkirk says her daughter went to Northside Hospital for help.
They gave her some medication, but they didn't do any tests. They didn't do any CT scans. If they did, they would have caught it.
The next morning, Adriana's boyfriend noticed something was terribly wrong.
She was gasping for air in her sleep, gargling. More than likely it was blood. She was taken to Emory, Decatur, and then she was transferred here.
To Emory University Hospital, where Adriana worked as an RN. Unfortunately, there was nothing doctors could do.
They did a CT scan and she had blood clots all in her head. So they had asked me if they could do a procedure to relieve them, and I said yes. And then they called me back and they said that they couldn't do it.
Doctors declared Adriana brain dead.
So I feel as if somebody dropped the ball at the hospitals, and her boyfriend asked, please keep her. If she was kept at the hospital, we wouldn't be here.
Because of Georgia's heartbeat bill, which bans abortions after a fetal heartbeat is detected, her family says they weren't given any say in what happens next.
It's torture for me. I come here and I see my daughter breathing by the ventilator, but she's not there. And I'm touching her. And she has a son who I bring to see her.
Now, 21 weeks pregnant, her baby's health uncertain.
She's pregnant with my grandson, but my grandson may be blind, may not be able to walk, wheelchair bound. We don't know if he'll live once she has him.
A situation she says no one should be forced into.
It should have been left up to the family because I'm in my 50s, her dad is in his 50s, so we're going to have the responsibility with her partner to raise her sons, you know? And I'm not saying that we would have chose to terminate her pregnancy. What I'm saying is we should have had a choice. We should have had a choice.
It's likely doctors will not induce Adriana for at least another month. And it's not just the baby's health the family is worried about, also a medical bill. They say that continues to grow every day.
All right, Cody, thank you so much. We know you'll continue to follow this.
The family says that their family member was declared brain dead, but her pregnancy continues because of Georgia state law. A woman in Georgia has been kept on life support for over 3 months because of the state's strict abortion law. Adriana Smith, a 30-year-old nurse and mother from Atlanta, was about 9 weeks pregnant in February when she suffered a medical emergency caused by blood clots in her brain. She was declared brain dead shortly after being admitted to the hospital. Under Georgia's heartbeat law, most abortions are banned after about 6 weeks of pregnancy. Because of this law, doctors are legally required to keep Smith on life support to give her baby a chance to survive. Her medical team is waiting until the fetus reaches 32 weeks, which could take several more months as she is only 21 weeks pregnant. Her family says that this situation has caused them deep emotional pain, and they worry about the baby's health since doctors say he has fluid on the brain and may have serious health issues. Despite their concerns, the law does not allow any exceptions in this case. This is yet another example of how abortion restrictions in Georgia are affecting real families. Since Roe v. Wade was overturned in 2022, similar laws have been passed in many states, leading to confusion and difficult decisions for doctors and loved ones.
So they're keeping a pregnant woman alive in Georgia who's brain dead because she's 20 weeks pregnant, and they said that they can't take her off life support because that would be an abortion. And it would be one thing if that's what she said her wish was, or her family's wish even, but it's against her family's wishes. Let me say that again. They are keeping a pregnant woman who was dead alive for her fetus, so she's literally just an incubator now, while her older son watches her and thinks that she's just sleeping. And if that doesn't make you throw up, then you, my friend, are the one who is dead inside. When will you stand up and speak out against these abortion bans? When it affects you? It's so sick.
A Metro Atlanta mother lies brain dead in a hospital room, being kept alive only because she's pregnant.
Literal Handmaid's Tale shit. I'm not kidding. Season 3, episode 9. The episode is named Heroic. A handmaid ends up brain dead, and she is kept alive in order to exist as an incubator for the fetus she's carrying. The episode is essentially a horror movie. It is probably one of the most devastating ones. And make no mistake, it was not an accident that the handmaid who was used to perfectly exemplify the usage of a human body as chattel in order to serve the desires of the state was a black woman. It's almost as if they knew. Adriana Smith is completely brain dead, but she's being kept alive against her family's wishes and without her consent simply because she's pregnant. Mind you, she's been on life support and essentially functioning as an incubator for over 3 months, which is longer than she was pregnant before this. She wasn't even 9 weeks along when this happened. But because of Georgia's abortion ban after around 6 weeks, except in certain cases, which as we know are still often ignored, she is now an incubator for the state. Well, sort of, because despite having no choice in the matter, her family is not only going to be raising the fetus if it survives, but they're also on the hook for all the hospital bills. Despite the fact that the fetus has fluid in the brain, which can lead to serious health issues and may even result in the inability to survive outside the womb. You understand that someone who has actually passed away has to give prior consent for their organs to be used, right? So I guess this confirms what we always knew. A corpse has more rights than an unconscious woman in a red state.
It's an experiment. The brain dead pregnant black woman in Georgia is an experiment. They are experimenting on her a la Henrietta Lacks. Okay, they are wanting to see if they can incubate babies via women who are unconscious or brain dead. If they can use us as human incubators, and they're using a black woman to do it first. Hope this helps.
Due to the statewide abortion ban in Georgia, there's a brain dead woman who is 9 weeks pregnant who's being kept alive by the hospital specifically so her brain dead body can give birth to the fetus. This woman is named Adriana Smith. She was 9 weeks pregnant when this first happened. She went to the emergency room claiming that she was having very bad headaches, among other symptoms, and the doctors did no CT scan, no nothing. Sent her home. Turns out she had blood clots in her brain. And so because they didn't actually look at her like they don't ever do with women, she's brain dead. And she's going to pass away. But first, because of the overturn of Roe versus Wade, she has to now be in a vegetative state for her family to watch just so that she can give birth to this child. Again, this is all because the doctors did not believe her and did not do proper testing to catch blood clots that were in her brain. What makes this even worse is that now all the medical bills are going to fall onto her family because the doctors would not listen to her and they could have caught this and could have prevented her from being in this state.
Should a pregnant person be prosecuted for eating McDonald's or not exercising enough? Or if a pregnant woman causes a car accident and she then miscarries, should she go to jail for murder? Someone is battling with addiction and they find out they're pregnant. Should they go to jail because of that? What if she's diagnosed with cancer and needs chemotherapy, but that chemotherapy could be toxic to the fetus? Should she wait until after she has a baby in order to get that treatment? And what if she dies in the meantime? Is that just considered okay? And should you be able to claim an embryo as a dependent on your taxes? Why am I asking these ridiculous questions? Because if fetal personhood laws pass, an embryo or a fetus is going to have the same legal rights as you and I. And those scenarios that I guarantee you're saying are hysterical and will never happen, they absolutely can happen. And where does the enforcement stop? And while a new study from the National Women's Law Center said that 60% of people interviewed do not agree with these fetal personhood laws, anti-abortion Republicans are trying to sneak them quietly into laws and bills. Talk to your friends and families about these hypothetical scenarios. See what they think, because we've seen that when people know what these laws mean, they understand just how bad they are for us, for our government, and for society as a whole. We know what you think about these scenarios in the
Pregnant
comments.
woman in Georgia who was declared brain dead is being kept alive by ventilators because of the state laws banning abortions. This is sick.
Yeah, it is.
Because what they're doing is running an experiment.
Exactly.
And they always experiment on black women.
Hey, listen.
Now, she couldn't get the medical attention that she needed that probably would have prevented this. Because what they like to say, drug seeking. Not patient in pain. Patient needs pain relief. Drug seeking. That's how the way they always view black women. The medical field has an extremely outdated view on black people. It is especially dangerous for black women. And it is tenfold more dangerous when they become pregnant.
That's true. My grandma always said when she go to the hospital that they treat black people like guinea pigs.
Oh, yeah.
Yeah. My grandma always told me that since I was a kid, bro.
Yeah, so this brings me back to Henrietta Lacks. Neither she nor her family were compensated for the extraction and use of the HeLa cells. So, revolutionized cancer research, cancer treatment and prevention. No compensation for the family. Experiment. Experimented. Black women can be used for the benefit of the medical industry, but do not benefit from the medical industry at all. The processes that they're going to gain and learn from this.
Because she is being studied on.
She's being studied. She's being used as an incubator, a human incubator.
Yeah.
And this child, another black child, little black boy, is an experiment as well.
Mm-hmm. How is he functioning? Is he doing good? Is he
There-
still breathing? How's the heart rate? All that.
Black women have been the center of medical research since slavery.
Yeah.
All the advancements in gynecology.
Especially gynecology. Especially.
So when we talk about, when we go back to my first point about black women and their concerns in this society, it's bigger than just what we can do to them as men. There's a whole host of enemies. The medical industry is a big enemy of black women, using them for medical research, using them to experiment, using them to advance and find advancements in medicine, but don't benefit from the medicine. If she had the CT scan the way that she was supposed to, she probably would not be here. The headaches was the telltale sign. She's also pregnant, which means if we do care about our patients so much as they said, let's make sure we run every test possible to make sure not only this woman is safe, but the baby that's inside her is safe. So we won't let you get rid of the baby, but we won't do anything. We won't do anything to help this baby get here safely.
The fetus has fluid in its brain and could be stillborn, have neurological disorders, be blind, and the list goes on. The fetus is not receiving enough oxygen. This is in response to the Adriana Smith case where Smith was declared brain dead at 9 weeks pregnant, but a Georgia hospital has been keeping her alive for the last couple of months in the hopes of getting her child to a live birth. The story broke last week, and there's been a ton of discussion about how the hospital is forcing the family to go through what is a traumatic situation. And a lot of it focuses on how the family should have the agency to decide, which I think is a reasonable discussion to have. But a lot of it focused on things like this, where it talks about how the baby basically can't possibly survive. Or some people will argue, well, maybe the baby could survive, but with a lot of serious disabilities that will make quality of life not worth living, and so on. The reality is that in cases where pregnancy continues after a woman is declared brain dead, the outcomes are variable. One review found that 77% of babies were born alive, and of those, 85% had normal outcomes by the time they were 20 months old. Obviously, the situation is not nearly as good for the baby as if the mother was alive and well for a whole variety of reasons. But to assume that in these situations there's no chance that the baby could be okay, that's not based on data. So it was notable that they published a follow-up article. It says, "We're just hoping he makes it. Family shares update on unborn baby of Georgia mom." The article is another interview with Adriana Smith's mother, April Newkirk, the grandmother of her baby. And Newkirk shared that her unborn grandson, whom the family has named Chance, is continuing to grow. Chance's heartbeat is strong, and he's measuring slightly above average in weight. His grandmother says he has his toes, arms, limbs, everything is forming. We're just hoping he makes it. She emphasizes again how frustrating and upsetting it's been that the hospital told the family they don't have any say in this situation, but she also said, "We want the baby. That's a part of my daughter." It's worth noting that the original media coverage of this story only said that the doctors told the family that there might be some fluid on the brain for the baby and they weren't sure how much. That's it. That was enough for countless commenters to argue that there's no possible way that this fetus could survive, or if he did, that he would have a terrible quality of life and it wouldn't be worth it. Of course, no one knows even now what the future holds for Chance, but hopefully now that his grandmother has explicitly said that they want him, other people will start to acknowledge that maybe his life
I'm
matters.
no medical doctor, medical student, nothing in the medical field, but I'm pretty sure that in the first in pregnancy in general, you're supposed to be talking to the baby, working out, making sure you're taking your vitamins, eating well. But as a brain dead patient, how are you able to do those things? Like, how are you able to do those things for that child? So my thing is, if this baby is in the first trimester, I think the odds will be significantly different if it was in third, but we're in the first. What quality of life would that baby even have? Like, the things that a mother is supposed to be doing in preparations for the child cannot be done because the mother is no longer with us. Getting pumped with meds just to keep the body alive. Or you think those meds is also going? Then on top of that, because it's the first trimester, there are several months to go and you think the baby's just gonna come out fine with no issues. No issues with the quality of life. Or possibly just come out stillborn. Like, and that's the thing that really be getting me when people be arguing about this pro-life business. You are not arguing pro-life. You are arguing pro-forced birth. Let's call a spade a spade. Because when it comes to governing women, especially black bodies, we've always been the experiments. So this is just another way, another precedent in order to do that again. All these technological and medical advances that we've had was at the expense of a brown or black person in agony on a table. So here we are again. Adriana Smith can't even die in peace because the government now owns her body, but not the medical bills that are attached to keeping a brain dead patient alive. And God only knows what was going to happen with that baby. So again, I'm no medical student. I am no doctor. But this is just a political stunt so that the autonomy that we still have left will no longer be ours. Because at 9 weeks, how many people know they're really pregnant for real anyway? How many? So again, you just gonna let the government keep doing what they doing? Open your eyes. Wake up, people. Smell the poop in the background. This is not good. And you can't even let this woman rest. Even in her death, she cannot rest. And that baby cannot rest. It is incredibly infuriating. Infuriating.
So it would seem to me that the pro-forced birth movement has no idea the incredible amount of effort it takes to keep a brain-dead body functioning. From the comments I've been getting and the DMs I've been getting, I think y'all think that the patient is just sleeping, and that's not the case. So as a doctor who takes care of brain-dead patients in the hospital, I'm going to talk to you about what's actually involved in that process to help dispel some of these misconceptions. And if you happen to be pro-choice and are watching this video, make sure you share it far and wide so it gets to the intended audience, okay? Let's get started. So once a patient is declared brain dead, which is an entirely separate process that I'm not going to get into, but after that process takes place, the medical team now has to take over all of the bodily functions that the patient can no longer take care of themselves because their brain doesn't function anymore. So one of those things is breathing. Now all these patients will already have a breathing tube down their throat and hooked up to a ventilator. However, we can't keep that breathing tube in permanently, right? After 2 weeks, we have to take it out because it can cause a lot of issues. So what we'll do is make a surgical airway. We'll make an incision in the throat right here and put in a tracheostomy tube and then hook that up to the ventilator. And then the ventilator does all the breathing for the patient and we can adjust it as needed. How many breaths they take, how deep those breaths are, how much oxygen they get, etc. We're also responsible for maintaining the homeostatic balance within the body because the brain can no longer do that. That means giving medications to make sure things like the temperature, blood pressure, and heart rate don't go too high or too low. We maintain it in a normal range. There's often a lot of hormonal imbalances that come in patients with brain death. For example, one of them is something known as central diabetes insipidus. So that's the patient can no longer absorb water from their kidneys, so they just put out liters and liters and liters of very dilute urine and they become very dehydrated and their sodium levels start to rise. So we have to artificially hydrate them and give them a hormone known as desmopressin to help reverse this. And obviously these patients can't eat, they can't swallow, they can't chew, so we have to put a PEG tube, which is a feeding tube, in their stomach and hook them up to tube feeds and then give them their nutrition that way. And these patients require tons and tons of round-the-clock nursing care just to take care of the things that you would take for granted, like brushing your teeth, cleaning yourself. Every time they have a bowel movement, they need to be cleaned. They need to have lubricating eye drops put in so that their eyes don't dry and they get corneal ulcers. So those are just some of the basic things we have to do every single day just to keep the body functioning, let alone the myriad of complications that can arise from being bedbound and brain dead in an intensive care unit. So what are those complications? Well, infection is a big one. And, depending on the medical devices the patient has, can inform their infectious risk. So, for example, if they have a central line for medications, they can get a central line infection and a bloodstream infection. If they have a Foley catheter for, bladder decompression, they can get a urinary tract infection. But a lot of these patients will get what's known as a ventilator-associated pneumonia, which, as the name suggests, is a pneumonia because the patient's on a ventilator. And they're going to keep getting those pneumonias. And every time they get a new pneumonia, there's a risk for breeding a multi-drug resistant bacterial infection, and we have to use stronger and stronger antibiotics every time. And the stronger the antibiotic, the more likely there will be side effects. And then we have to treat those side effects as well with more medications. And even with the best nursing care and the best occupational and physical therapy, the body is going to start to break down because all the artificial support we give is no substitute for just normal bodily processes. So the skin will start to break down and ulcerate and get infected. The limbs will start to atrophy, the muscles will atrophy, the limbs will start to contract, and this can go on for years if the patient's underlying health status was good before they became brain dead. Now, I know this is a long video, so I'm gonna wrap it up. But the thing is, sometimes patients' families want this for their loved one, and we will honor their wishes. We will do it. We have the capability, we have the technology, and this is why we went into medicine, to help people, to help families. But there are families who don't want this. They don't want to see their loved one suffer like this. So they withdraw care, and all that stuff that I just said, we just stop and allow the bodily processes to cease. But the important thing is, we honor the family's wishes. And that's what I don't think you're getting right here. The family in Georgia does not want this, but they're forced to do it because of the law that you championed. So,
and this is why I say the pro-life crowd are full of shit. If you haven't been following the Adriana Smith case in Georgia, it just got a little bit interesting, and it demonstrates how dangerous it is for women not to have complete and total bodily autonomy. For some background on this case, Adriana Smith, 30 years old. She and her fiance went to the hospital because she was having headaches. She was a registered nurse, so she realized that her headaches were not normal headaches. She knew something was wrong. As most hospitals do, they did not listen to a black woman who said that her symptoms were out of the ordinary and she needed a specific medical care. She needed them to keep her at the hospital. They sent her home. They didn't do a CAT scan, which could have essentially led to a surgery or something that could have saved her life. But no, they decided they didn't want to listen to her concerns, and against their wishes, they sent them home. Not even a day later, Adriana's fiance finds her unable to breathe, gurgling at the mouth. They rush her back to the hospital, and finally, they do a CAT scan. They found blood clots in her brain and pronounced her brain unalive at the hospital. They put her on life support, and at that point, it should have been up to the family what to do with her body. It wasn't, because she was 9 weeks pregnant. And what is coined as the heartbeat law, which is actually the Living Infants Fairness and Equality Act, the Life Act, that was set in 2019, made it so the family could not decide whether or not to take her off of life support. First of all, fetuses are not infants. Let's just get that straight. You don't call an 8-year-old a toddler, do you? No, you don't. You have to be in a certain part of development to be called an infant. So the fact that they're even naming this living infants, a fetus is not a living infant. Is not at the developmental stage to be an infant. There are developmental stages of babies, and infants are not still in your belly. So it's disingenuous to begin with. Because she was pregnant, that choice was taken away from the family and given to the government. But pro-lifers want smaller government. Got it. This is the thing, though. They are keeping her alive, even though her brain is no longer living, so that she can incubate a fetus they are not even sure is viable. It's been 90 days, and there has already been signs of fluid around the fetus's brain. They don't know if the fetus is going to be blind when it's born, whether it will have Down syndrome, which is usually the case in those situations, whether or not the fetus will suffer in life. These so-called pro-lifers don't care about that. They also don't care about giving it healthcare, giving it food, because they are stripping away all the programs that would do that. And while they're keeping Adriana in the hospital, despite what the family wants, they are charging the family daily, running up a bill that they are going to charge the family. This is why not having full bodily autonomy is dangerous. Because Chris Kerr, the Attorney General of Georgia, his office said Adriana Smith's case, that act actually doesn't apply. There is nothing in that act that says that they must keep a woman's corpse alive if she is pregnant. There is nothing in that act that says that. That act does not even apply to Adriana Smith's case. This hospital is torturing this family. Adriana Smith has a son who is looking at his unalived mother. Adriana's mother goes to visit her unalived body every single day. Do you think she's getting closure? What about those lives? And all of you people who are talking about divine will of God, then God would have kept her alive until the baby was born. Your God didn't. It is not up to you to do that. If that is what you believe, you are disingenuous. You only believe and act upon the things that you want to believe and act upon and force on everyone else. And what if the fetus in Adriana's body is born into a baby with developmental issues, while the current administration has cut hundreds of billions of dollars that would have gone into helping that child who now has developmental issues? You all call yourselves pro-life. Whose life? Pro whose life?
I need you to watch this video. I believe that Adriana Smith, the black woman that is brain dead and being forced to have a child in Georgia, is setting the groundwork for a concept known as whole body gestational donation. Concept where people that are brain dead but otherwise good physical health are used as incubators to make children. It sounds far-fetched, but it's not. It's something that's been talked about for over 40 years now. It was originally talked about by a bioethicist in the 1980s, and then in 2000 it was brought up again by an Israeli doctor. And recently another doctor brought it up again. And all of this is documented in the National Library of Medicine. The basic premise that's used is that dead people cannot suffer, and therefore they lack rights and autonomy to their own physical bodies. They've also said that women who have previously given their consent could be gestational carriers. And this is a direct quote, making use of an otherwise wasted resource. But it gets worse, because their entire reasoning behind it is 100% in the self-interest of other people. It's mentioned that this could offset the expense of surrogacy, that people that want to be parents but can't, whether due to physical or financial reasons, could have their wishes fulfilled. Even though this is something that's been discussed for 40 years now, it does seem like there are more doctors that are against this than there are for it. Doctors have written rebuttals about the pain and exploitation that can come from assessing someone's autonomy during